over the last 10 years and is now reaching 80 million. To take matters even worse, the COVID-19 pandemic has sparked a crisis of global magnitude, and infodemic, a word coined by the WHO, has become a buzzword. These culminating crises have further aggravated the refugee situation. In 2020, more than ever, reliable, unbiased information can save lives.
Hello and welcome to day 8 of DW Academy's first virtual conference on communication, engagement, and accountability in crisis. My name is Wanjiko Mwaura.
And I am Eddie Micah Jr. We are your moderators. We've been your moderators for the past days and will continue till the rest of the week. Now, on Tuesday, we talked to community reporters about two projects, okay? One in Lebanon and the other in Kenya, on how they dealt with getting vital information to their communities during the pandemic.
That's right, Eddie. And in just a few minutes, we will be joined by a group of researchers and media experts who will be discussing the topic, getting the word out. How do we improve messaging and communication in refugee contexts?
That is definitely a key question. If you want the answer, you would have to be a part of that discussion. Okay, so I'm sure you're looking forward to that one in particular. You have the chance, of course, to pose your questions to get answers from the experts that are on board. A Q&A section of today's discussion, all you have to do is just go to that part. You know, when you check your app, you go to the Q&A section, and then you can pose your questions to whoever you want to answer.
And now that we have everyone on board, including you with your questions, for the next 35 minutes, Charles Martin Schills, a senior researcher at the German Development Institute, will be moderating this panel discussion. Now, Charles will be joined by Amanda Alencar, who is an associate professor at the Erasmus University of Rotterdam.
That's right, Wanjiku. Also joining the discussion are Tobias Denskus, an associate professor at Malmö University, Kate Gunn, a senior project manager at the BBC Media Action, and Aarni Kuoppamäki, the project director of the Refugees and Migration in Africa project. That's at DW Akademie. Charles, please take it over from here.
Eddie and Wanjiku, thank you so much. It's a pleasure to be here and to be joined by my co-panelists. I'll give a little bit of a background on what motivated me to set up and want to moderate this panel. Some of this was a mix of wanting to bring together voices from research and voices from practice. You can see on the panel, we have a nice balance there. And I come from a world kind of in the middle. At the German Development Institute, we do both scientific research, but we also have a policy advice component and do a lot of work with the German Federal Ministry for Economic Cooperation and Development. And part of that work for the past few years has included a lot of research on forced displacement and migration. And for me, the focus over the past 18 months has been the role of digitalization in the lives of migrants and refugees. So looking at how migrants and refugees use things like mobile phones, social media, but also how they gather news and information. And especially thinking in terms of how people get information about kind of critical events, critical needs, especially healthcare, which is something we'll focus on, really came through in the fieldwork, especially that I did in Kenya and Malaysia. And what brought me to this question about how do we use research and practice to kind of identify new ways and more effective ways to get reliable information into the hands of displaced people and refugees came with me or came from an experience I had in Malaysia. I was interviewing a young man. He and his wife were expecting a child, and we had asked a question about using social media and the internet to gather information about health and healthcare. And what he described was, as a refugee living in Malaysia, that country is not a signatory to the Refugee Convention. So there's no guarantee of access to public services. And there's a lot of confusion about what you can access in terms of healthcare in this case, what the costs are. And it's a challenging environment for experts. And UNHCR talks about the challenge of kind of negotiating and working with the government. For refugees, that challenge is magnified. And he said, you know, as he and his wife were working through this, there was a lot of competing information. They couldn't get clear answers from social media, the internet, from UNHCR, or answers that they could understand as clear. But one thing they were really worried about was cost and going into debt. And what they ended up doing in the end was smuggling themselves from Kuala Lumpur back into Thailand to have the baby, and then smuggling themselves back across into Malaysia. And this example really, I mean, it struck me that for this couple who are under the stress of having a baby and all the challenges and risks that come with that medically, in a space where they couldn't get information that they felt was reliable, they added to the stress of having a baby by feeling they needed to undertake this journey to Thailand and navigate all the risks that are attendant with being smuggled across a border. And that story that he told really struck me, and I thought this is something that I think is a conversation where the experiences of academics like Amanda and Tobias and the work that they've done can really speak to and I think add theory and kind of enhance the work that Aarni and Kate do on the media practice side. And I think it's a great space to have conversations about kind of how do we do messaging and media and information management in these communities better. And with that, we'll go in order. We'll start with Aarni. We'll tell us a bit about the applied research that he's been doing with Deutsche Welle Akademie on media access and media use in East Africa. And then Kate Gunn is going to talk about the work they've been doing kind of around COVID and health in Bangladesh, BBC Media Action. And then we'll come with the academic perspective. Amanda will talk about her work in Brazil, Latin America, looking at the kind of community, the micro level in terms of how people and how displaced people use these technologies to share information and create social networks and community. And then we'll end with Tobias kind of giving us an overview of kind of internet cultures and what these mean in development and what they mean in media, and we can tie it to the humanitarian questions we'll be looking at as well. So with that, Aarni, I'll go ahead and hand it over to you, and when you're all done, we'll move into Q&A.
Thank you, Charles. Yes, I'm one of the practitioners on this panel. I'm in charge of a project on refugees and migration in Africa at DW Akademie. The aim of our project is to improve access to information for people affected by displacement and to improve their opportunities to exercise their right to freedom of expression, to also further dialogue between refugees, IDPs, and host communities. But in the context of our project, we have also conducted some research, and that's what I would like to tell you about. When we started out with this project almost 2 years ago, we were wondering about quite a few things. We wanted to know, how do refugees inform themselves? How do they receive information? What sources of information do they use? What sources of information do they trust? And that's why we conducted information needs assessment in the regions where we work, in Ethiopia, Kenya, and Tanzania. To give you an overview of the studies we did, we worked in the Gambela region in Ethiopia, in in the Turkana region in Kenya, in and around the Kakuma refugee camp and Kalobeye integrated settlement, and in the Kagera and Kigoma regions in Tanzania. In those countries, those are some of the regions where you have large refugee camps and a lot of refugees. We talked to both refugees and members of the host community in quantitative surveys with more than 1,700 respondents in refugee camps and around them, and a number of focus group discussions and key informant interviews. And we didn't do this research ourselves, but it was done by our research partner, Pan-African Research Services Limited in Nairobi. Now, these studies are quite extensive. We're going to publish them. There's going to be like 200 pages of studies for everybody to go through. I just want to highlight some of the findings from the studies. One of them is that the settings in which we work are quite diverse. One thing refugee communities in Eastern Africa have in common is that literacy tends to be low, and there's lots of languages. So radio is naturally one of the possible sources for information for lots of people. However, our study showed that in 2 of the 3 locations where we conducted the information needs assessment, refugees did not listen to much radio, either because it was not available, or because they did not have devices, or because there was no content in the right languages and the right kind of information. So in both Kakuma, Kenya, and Gambela, Ethiopia, radio listenership among refugees in our survey was below 25%. It was significantly higher in Tanzania, though, in Kagera and Kigoma at more than 50%. So this informed us in how to design our projects. Now, if people don't listen to radio, then how do they inform themselves? That as well was quite different in the 3 locations. We found out that in Ethiopia, the most important source of information for people was UNHCR and the Ethiopian Agency for Refugee and Returnee Affairs, other people, including community leaders, and then radio as one source that is being used, but much less than the other sources. In Kakuma, Kalobeye, Kenya, the source most mentioned was FilmAid, an NGO, which we work with now, other people, and the classical media only after that. And in Tanzania, clearly the most commonly used source of information was radio, which means that when we were looking at how to design our project, we decided to work with a radio station, the most listened to radio station in Tanzania, but find other ways of reaching the people we want to reach in Kakuma and in Gambela. In Kakuma and Gambela, we're basically training young people, young refugees, to create audio content in the right languages for their communities, and then we're distributing it kind of in a more manual way, not using radio, to the people who need it. Now, some of you might wonder, what about digitization? What about the internet? So we also looked at that, and we saw that in the locales where we were working, internet use was much more widespread among the host community, especially in urban areas, than among refugees. Here you see a comparison of the different locations. We see that the host community in Gambela had almost 40% internet usage, but the refugees in general hardly had more than 20% internet usage. So kind of going a purely digital way would not have worked for us either. So this is basically what we looked at, and this is what we used to conduct project planning workshops together with the organizations we were working with, and design interventions based on our research results.
unmute. I apologize. Thank you, Arnie. As we've transitioned to Kate, something that jumped out to me was, with the exception of Gambela, in Tanzania and Kenya, the trust or use of information from UNHCR was relatively low. It kind of struck me as I was thinking about it. And what is the mechanism behind that, and what's kind of going on, and how do you bridge or bring together official information in a potentially loud space? And Kate, I'm going to go ahead and hand over to you now to talk about the work that you've been doing in Bangladesh with BBC Media Action, and we'll hear a bit more about how this works on the ground.
Great, thank you, Charles. And very interesting listening to Arnie's presentation, a lot of sort of similarities between two refugee settings, you know, from across the world. So I'm working in the Rohingya camps in Cox's Bazar. There's almost 1 million Rohingya living there, and it's a very significant challenge for the humanitarian community and Rohingya community to be able to communicate with each other. And so that's obviously, you know, one of the most essential things that people need to do so we can understand each other. I mean, it's difficult because there's no agreed upon written Rohingya text. And so, you know, in thinking about how to communicate, everyone had to come up with sort of different models. Often radio would be a way that people would communicate with populations who don't have written text or who are illiterate. But there's a limited signal reach, and it's not always possible to broadcast in Rohingya language. Another way might be digital with internet, but the use of internet by the refugees is not completely legal, and there's not always signals in the camps. So it's so what ended up having to happen was that it was face-to-face communication is seen as one of the most trusted ways for people to communicate. And so you put together information and content in places where people would meet. So this is pre-COVID, this picture, in a nutrition centre. So people would come together and have discussion groups and listen to audio programs, videos, graphics, visuals to help people understand, such as in this nutrition centre. And other places where people would, other ways that we would get people, assist people in communicating would be to have listening groups. So you'd bring people together and you play audio or radio dramas. This was about gender-based violence, and have a discussion afterwards, because we know just providing the information isn't enough. And for people to really understand, to be able to ask questions, etc., we would run discussion groups. But this obviously involves people all coming together and getting close to each other, which is a problem when COVID came along, because it's no longer possible to have people all in close contact. So, you know, when COVID came along, it was a very new disease for everybody, for all of us, obviously, and particularly for the Rohingya and refugees. They knew very little about it. People lived very close together, and there were real concerns and estimations that there could be quite high mortality rates. So it was really important to try to get information out as quickly as possible. And really the information is not to come together, to stay at home and don't mix. So the ways that we had given information before, we had to change that. So this is a group of community health workers, and they go door to door, and they're a very trusted source of information. People like meeting other people, talking to face, but these people don't always have, the community health workers themselves have some Rohingya skills, but they need support with graphic materials. So we produce flip charts to help them explain the issues. Now, obviously what they're trying to explain are quite complex issues. They're complex for me to understand, they're complex for you to understand. So they're all very new words. It was, you know, testing, isolation centres, quarantine, And, you know, one thing that does spread are rumours. So you got lots of rumours going through the camps. There were rumours about don't go to the health centre, you'll get killed. There were rumours that food will cure you, food will increase the risk of COVID. So we had to really work together to produce, we produced short audio programs that went out on WhatsApp groups for those who could get the internet, even though you're not really meant to, tom-toms, loudspeakers. And, you know, I think sometimes there's this expectation that everybody will understand something straight away. So at one stage, the health sector were very concerned. Why aren't people going and getting tested? What's going on? We've only been giving them this information for the last 2 weeks. You know, it takes time for people to listen, to understand, to start to trust, to know someone who might have been in an isolation centre. So we went and filmed in isolation centres and quarantine centres to show that, you know, things weren't too bad there. We spoke to people that had been at these quarantine centres so that people could hear firsthand from their community what happened when you went to these places. And this is obviously the Rohingya community who have been through genocide, who were forced to flee Myanmar. So, you know, they've got lots of issues themselves and lots of concerns. So this was, you know, it's very hard to continue to have trust. And so there was also research that people didn't trust the health centres. While they might have had high trust in community health workers, they didn't trust the health centres. So we also had to work to try to get people to get more testing done and to go to health centres. So what we're seeing now is almost 90% of people, or 80%, I'm sure the statisticians amongst us would say 90%, there's a worry with that figure, but across a number of different research findings, there's high rates of understanding about how COVID is spread, what the signs are, etc. Slowly but surely more people are going to get tested. But it's quite interesting. We're not seeing, and luckily, we're not seeing high death rates. There's only been 8 or 9 people who have died from COVID. Now, you could say, well, people have died from, you know, people have died, you know, we don't necessarily know how they died, but there's not an increase in death rates across the camps generally. The testing rates, while they're going up, they're still low. So you could say, well, we don't know how many people really have got COVID in the camp, and that's true. But if you go around, the community health workers have been testing to see who has mild, moderate or severe symptoms of sort of acute respiratory infections or similar things to COVID. And it's similar to last year. So we actually really don't know what's going on and how many people really do have COVID, but we're very pleased to see that there's not too many people in the isolation and quarantine centres. You know, people are increasingly getting tested. Mask wearing is being encouraged in the camps, and there was another survey. Unfortunately, people did it over the phone because you can't, they're trying to stop too many people going to the camps. And most people have masks, and they all said, oh yes, we all wear them, but in fact we know that's not true, because when you go to the camps, that number of people are not wearing masks. But I think it possibly shows that people know they should be wearing a mask. So the next step is encouraging people to wear masks. So when asked why people don't wear masks, it's the same reason that everybody out there don't wear masks. They're uncomfortable, they're, you know, maybe they don't believe in them, all those sorts of reasons. You know, it's certainly been, it's a very interesting place to work and to try to get information out there using a range of different sources, with added challenges when we can't get people to all come together like we would pre-COVID time. So thanks, Charles.
Kate, thank you so much. And you kind of done a really nice job of talking about this micro kind of community level. As we move over to Amanda, yeah, something you mentioned, Kate, is this question of understanding straight away. And Amanda, it made me think of something you brought up, which is different digital literacies, and that you know, how understanding is created within these media can vary quite a bit from community to community, and what that means for information. So Amanda, I'm going to hand it over to you now to kind of bring us into the kind of digitalization and displacement space from the academic side.
Thank you, Charles. So my research focuses very much on, right now, on Venezuelan forced displacement to the northwestern region of Brazil. So last year we conducted a digital ethnographic study through a WhatsApp group with a small group of Venezuelans. And but I just would like to contextualize a little bit the region, and so then I can give you more information on a study. So precisely, I think, yeah, here. By the end of 2019, it is estimated that more than 220,000 Venezuelans crossed the border, as you can see in a red arrow, entering Brazil through the border city of Pacaraima. And once they get to the city, they have access to shelters, are provided with support for basic needs. Even though Venezuelans are allowed to work, there is an overall lack of employment in the region. And at the same time, more than 65% of Venezuelans feel that they do not have enough information about services, health services, practical information, but also information about their legal rights. And this is mainly due to their lack of access to reliable and constant and continuous digital communication and connectivity. In that regard, it's important to mention here that there have been interesting initiatives the same way that Aarni and Kate mentioned. But some of these initiatives by local actors in partnership with humanitarian actors, humanitarian agencies, in terms of providing, for instance, limited access to internet, or for a short amount of time, or computer labs, computer classes. Some applications and platforms have been developed, but the same way it happened with the 2015 refugee crisis, these apps or platforms did not really take into account realities and conditions of refugees, despite good intentions, of course. There are disconnected imaginaries of the digital in different contexts, and northwestern region within the Venezuelan forced migration context is not different. Just to give an example, very recently we interviewed one of the people who participated in our group, in our WhatsApp group research, which I will talk about very quickly, very soon. And she mentioned that there was a WhatsApp group that has been created by one of the humanitarian agencies working in a context, and the group was precisely aimed at trying to analyze the efficacy of a platform they were implementing. The problem is that most people could not sustain connectivity. They could not ask questions that were not directly related to this platform. So especially in current times of COVID, people have the necessity to ask other questions. So the group was, there were different goals and different objectives. And with that concern in mind, my colleague and I, my colleague Julia Camargo, who is director of the technology center in the capital city of Boa Vista, which is the state of Roraima, where most Venezuelans enter through when they come to Brazil. We organized this study with a small group of 18 Venezuelans, and we provided smartphones and the minimum connectivity that they would need to engage in the WhatsApp group that was created. So the main goal of this study was precisely to further understand their everyday struggles, how they were creating space, how they were creating place in a new city, the challenges and opportunities, and how having access to more constant, more reliable connectivity could potentially help them address these challenges. Very important to mention is that the group was very diverse, not only in terms of their socioeconomic backgrounds, but also in relation to their aspirations for making a new life or creating a new life in Brazil. And some of the collaborators were living in the shelters. Others were, at some point, had to be living in the streets, and some people also shared house with other Venezuelan families. I would like to highlight some key main findings so far due to the time. Most important, like the first finding, is the strong network of support that has been created. They were sharing relevant but also practical information about different needs and topics that emerged within the group, but also providing emotional and effective support within the WhatsApp trajectory. But however, there were some tensions that were created regarding different expectations regarding care and attention. Some members, they would require more attention from regarding their problems, regarding their needs, and other members had different views about that, about these kinds of interactions, and were not always available to provide that kind of support. Another source of conflict that emerged within this group during the time we conducted the research was the types of content that were shared in the WhatsApp group. So for example, information about employment or information about different stuff going on in a city that could not be verified, or political discussions, or even sharing inappropriate personal content in a group. So this led the group to set rules about what was allowed to be shared, but also how the different collaborators, the different members should behave. For example, there was the case of this Venezuelan man who left the group without letting us know what happened. Nobody knew actually what was going on, and people started judging. People started actually saying, okay, so this is not you're not supposed to do this. We need to have a commitment. We need to continue the research. But weeks later, we found out that his phone had been stolen. So, but just for you to have an idea about the negotiations of conflicts and power relations that were happening within the group. And the final point, if I may, I would like to address the different creative literacies, the creative engagement to bring attention to their struggles in a city. They actually engaged very creatively in a group when it comes to sharing animations, memes, GIFs, and other visual symbols to bring attention to their struggles as sort of it's kind of a source of activism and a form of activism, but also a way of coping with the difficulties they were living. Some of the participants who did not have any kind of contact with a smartphone before produced an artistic video about their lives in a shelter and how the life of an asylum seeker in northwestern Brazil looks like. So with that, I just would like to bring attention to the importance of course, this research was only made possible because we actually provided the phones and some connectivity, but there is full potential for, and there is actually greater need for complementing surveys and complementing technology projects with more digital ethnographic research in these contexts. And also they need to broaden and deepen our perspectives on digital literacies. But I would like to discuss that more afterwards. Thank you very much, Charles.
Amanda, thank you so much. That's nice. I think a nice transition, and it now gives us a second regional case to talk about. We're kind of covering a broad swath of the world, and this macro perspective brings us to Tobias, who will anchor our panel, kind of scaling back up. Something that jumped out is this differences in geography and culture, and for me, kind of thinking about what do different internet cultures mean, especially when organizations and media are trying to communicate. So Tobias, I'll hand it over to you.
Thanks, Charles, and welcome from Malmö, Sweden. I think you're really sort of pointing out my contribution today, which is in a very academic way looking at some of the paradoxes of communication. And if you remember sort of, from Aarni's survey findings to Kate's hands-on experience in the refugee camps and now Amanda's WhatsApp group, you can see that there's an amazing sort of communicative ecosystem that, researchers and organizations are using. And the research I'm doing often takes place in another field, the internet, which means I'm getting paid by the Swedish taxpayer to look at memes and Instagram and Twitter. And very often, once we are sort of done with some of the communication, we are ending up with something like this. So we have an amazing sort of broad spectrum of creative storytelling and digital ethnography. And at the end of the day, there's a picture right now, especially with some of the medical supplies, boxes awkwardly stacked somewhere. Somebody put a label on. I'm feeling a bit sorry for the German Development Corporation, IOM, which I don't want to particularly sort of put on the spot. But you see a lot of the ways that the donors, that the large organizations are struggling to communicate some of the really nuanced creative findings from the field. And it was interesting that we also had the example from Bangladesh, because this is something I encountered recently. And you would say, well, what's so special? But for me as a researcher, it's that kind of ritualistic communication. There is a panel, there's big chairs, a huge podium, men talking, and in the background you have a huge plasticized banner. This is an orientation for media personnel, and it's that kind of way how some of the disjunctures often happen in communication is. You have the so-called beneficiaries, you have diverse groups, and especially as Amanda was saying, groups that self-organize, that have their own rules, that are very sort of aware of how media work. And then at the end of the day, it is sort of a lessons learned workshop in the Hotel Beachway. And I don't have a good answer. So this is also sort of where me as the academic sort of come in, is that very often, I recently attended a meeting of the OECD DAC group on branding. And from the participants, it was clear how challenging it is for some of the large donors, especially the bilaterals, to not fall into the traps and sort of communicate in sometimes almost sort of stereotypical ways. Very sort of typical example, this is UNHCR. And you see the pictures carefully calibrated. The woman sort of sits on one side, and and you can, I think you get the idea that this is UNHCR by looking at the 8 boxes of gear. And I know from discussions with colleagues in organizations who work in comms, is to really find that balance. How can we communicate in a way that's sort of globally applicable? I mean, you probably have come across some WFP content since they were awarded the Nobel Peace Prize. So how do we find that language that communicates our mission? You see the trucks, you see the distributions, a plane takes off. It communicates the humanitarian work, but especially when you have more sort of traditional development work, there is a real challenge is how can we communicate in a global language, not sort of using sort of some of the stereotypes, and really, sharing some of the nuances. And I think many organizations are risk averse. They could do much more. And I think the 3 examples previously really show this well. There are so many interesting things. You put out a call, you put out a tweet and say, hey, we funded a project with BBC Media Action. What are your findings? You don't have to go back to some of these presentations. And unfortunately, and I'm hoping nobody from IOM will take offense. This is from a short video from, I think, 2018. And IOM Bangladesh, and I think that also gives you an idea of how important Bangladesh is right now in the humanitarian and development space. IOM Bangladesh tried out something differently, and they produced a short video with one of their, or I think it was the country representative, and it didn't go well. Luckily, I saved the video because the IOM decided to pull it off their Facebook page very quickly. Because there were many comments about how this was sort of not representing the work. You know, it's a very condensed 3.5-minute video, a day in the life of a humanitarian, and we are following the IOM chief sort of, you know, through a condensed kind of fictitious day, picking up coffee in the morning, flying out to Cox's Bazar, visiting refugee settlement, and returning in the evening. So they tried out something else. The execution wasn't perfect, but there was also lots of negative comments from the humanitarian community, people complaining, sometimes sort of very specifically, well, you know, he leaves the office and gets straight into a car. Why isn't he filling out the 5, you know, security forms that are necessary? But also sort of a broader critique of the way that, you know, he is sort of, as I don't want to say white savior, I think that it's taken it a bit too far, but as sort of, you know, the main character, the expat IOM worker leading through the short video. There is so much more I could talk about, but I think it gives you an idea, and that's basically how, you know, how we're leaving it a bit more open-ended at this point, is, you know, I think we are also in research and in applied research, we are aware of some of these challenges of how to communicate. I think we are also very much ready to support, especially larger bureaucratic organizations in their communication efforts, especially if they're eager to try out something a little bit differently and move a little bit away from the sort of ritualized corporate language. So, and I think I'm extending that invitation. I'm sure that's true for all of the panelists. Is, you know, talk to us. You know, talk to us. Share your concerns, but also ask us what we can do to communicate a little bit differently, a little bit more around the modern tools we have, and maybe also a bit more risky, not in the kind of, you know, really kind of terrible way, but in a good way to say, you know, this may be something that attracts positive attention. Thanks, Charles, for inviting me.
Yes, and thank you, Tobias. You laid out in the images, especially that last one, something that I'm gonna do one question before I hand it to the audience. So I know we're creeping up on time, but this one question that kind of came to mind as I was juxtaposing what I was hearing was, you know, from what Tobias showed us, Kate and Amanda, in the work you were doing within, I would say at the micro level and the community level, you know, how does something like this last video example from Cox's Bazar, well, how does it affect trust or feelings of inclusion in communities? And when IOM, in this case, makes a mistake like this, you know, does it have long-term effects on how communities view organizations and the information that they can get from them? Or at the kind of community and household level, are the day-to-day challenges and things they have to deal with kind of, you know, this is maybe a level above? And I'm curious just to hear if you have kind of experience seeing what happens when an organization makes a communication mistake, and how the communities perceive or don't perceive it.
Well, I think that while not talking about that specific video, I think probably most of the community would never have seen the video, and it wouldn't be relevant to them at all. And I think that you know, often when you're talking about communication, the organisations all think about communication to the outside world. You know, people reading the newspaper in Berlin know more about what's going on than people living in the camps, and or it's communication to try to get donor funds. So it's really important for I think organisations to think about community engagement, and I think often it's one of the last things that they think about. And you know, when they do communicate with the community. It needs to be information that's actionable, that's accurate, and that's easy to understand. Because people need to feel like they're listened to as well. You know, they need to feel like when they give feedback, ultimately somehow the loop is closed and something changes and things happen as a result of all this research that gets done, and people ask many, many questions, that actually something changes in their lives. So I think that's what I'd say. Thanks, Charles.
Amanda?
Yes, I agree with, of course, with Kate and Tobias. Precisely, there have been a lot of so far disconnections, but at the same time there are interesting initiatives taking place, but also good intentions in terms of developing more community engagement. However, of course, these issues have to be analyzed. It's context dependent. So at least in the Venezuelan context, in particular on the northwestern region of Brazil, we can still see that the imaginaries of how information should, the efficacy of information to reach refugee communities, the mechanisms that need to be put in place for this information reach refugee communities efficiently is still in the making. And the impression that I have based on extensive field work, but also connections with different actors working on the field, is that there is still a lot to be done. Disconnections exist, imaginaries, intentions, and as I said in the beginning of my talk, more than 65 Venezuelans feel that they do not have enough information about the things they need, or at least relevant information about their rights or practical information, so to speak.
And it's kind of interesting when both of you mentioned practical information. When I was doing the research with my team in Kenya in Kakuma, we asked a question about using digital channels to get health information. And what was kind of funny was we asked these questions and our interviewees would kind of stop and look at us very confused. And a number of times they would say something to the translator, and the translator would say, they don't understand why you wouldn't just go to the doctor's office, because that's just what they do. Why would you go on the internet and look for health information? Just go to the doctor. And it was really interesting from the perspective of someone working in the development sphere to think, health information is this process that we do. And for people in daily life, they were just like, no, I just need a doctor, and if it's available, that's where I'm going to go. I'm not going to go through this rigmarole of searching the internet. That's a step I don't need to take. It was interesting for me from the perspective of a quasi-practitioner to go, so I wonder if sometimes I overthink this to a certain degree in terms of information management. We have about 12 minutes, so what I'd like to do is hand it back to the studio, to Eddie and Wanjiku, to channel as many audience questions as we can take. These inputs, I think, were fantastic and have probably generated more thought and questions than we can possibly cover. So with that, Eddie and Wanjiku, please.
Thank you. Thanks a lot, Charles. And indeed, you're right. It has generated lots of questions. So thank you for leading that discussion to getting us to the point where we are at now, the Q&A. Thanks to our panelists, Amanda, Tobias, Kate, and Aarni, for sharing your insights. Eddie, let's jump right into the Q&A section.
Yeah, let's jump right into it because I believe Charles took a bit of the time, but it was still valid information being given. So we forgive you, Charles. But the first question comes from Luvini Ranasinghe, who's basically posing this question to Kate. Says, how was the rumor tracking done? So how was the rumor tracking done? Kate, a quick one.
Yes, so the rumor tracking was done by, because less people were trying to go to the camps, so we would rely on different organisations and community-based organisations who were Rohingya as well to collect the rumours. They would send it to us and we would analyse the rumours. And it was generally, you know, it seems to be, I think there's 5 types of rumours all around the world that are the same sort of rumours. There's usually something around religion, something around food, superstitions, things like that. So that's how the rumours were tracked. And then we would let the humanitarian community know what the rumours were. And we would also try to produce content. We produce short audio content that would address some of those rumours as well. Thanks.
Thank you for that response, Kate. I follow up quickly with another question from Liku Gebra, who asks, as refugees are in constant movement across borders and inside the countries they live in, could you please share your experiences in delivering messages across borders and across refugee camps? I think this goes across the board to each and every person, especially the practitioners.
Well, maybe I can say a few words about that. One thing we have noticed is that Lico is making a good point. It is very relevant to refugees and their families to have information from the other side of the border. Refugees need to know how it's situation at home. People who stayed at home need to know how it's situation in the refugee camps across the border. We also know that it is difficult to get this information. People individually resort to phones, try to call home and find out what's going on. One thing we have done at the Akademie was supporting a network of radio stations between southern South Sudan and northern Uganda to come together and share information. So basically the South Sudanese radio stations provide information to the Ugandans and the Ugandans provide information to the South Sudanese. And I think one thing it has definitely done is kind of creating mutual understanding on the side of the media practitioners towards the people on the other side of the border. So that's one of the things we have done, but definitely the challenge of getting information from home or from refugee camps across the border remains.
Anyone can add up if you have any.
I am particularly interested to hear such concrete examples, such as the one from radio stations in South Sudan and the ones in Uganda. So please, Kate, especially from the BBC Media, perhaps you can give us an example as well.
Well, so for the Rohingya, it's particularly difficult given that they fled from Myanmar. So, you know, there's a percentage of them who have family left behind, and so a lot of it is using phones and the internet. So there's some research being done on this side of the border, but I think it's much more difficult to find out what's going on in Rakhine State. The internet has been down for much longer, so it's hard for me to say sort of what sort of information there is on the other side of the border. But I understand that obviously families communicate, but I don't have any sort of first-hand information on that, so I can't really comment. Thanks.
Okay. So then, still checking out a couple more questions. This is one that I'm sure could go to Tobias, but of course anyone can jump on it. This one asks, there's normally low awareness within humanitarians or among humanitarians about communication and community engagement. Any best practices on leveraging the support of humanitarians to deliver a coordinated and comprehensive messaging?
Wow. Well, that's that probably leads us to another 1 hour session.
Hopefully not.
I'm always, and I know, I'm in that kind of privileged position as somebody who is in academia. I'm always, happy to say, be authentic and, and follow the flow and, use the tools and the platforms, that are naturally used, by the communities you work with. And I think that's often difficult. And I know many organizations have very complicated regulations. So I wish sometimes it would just be possible, to post an image on Twitter from what is happening in the field right now, rather than going through a regional office or a headquarter. And that extra little bit of being, being authentic and using the internet culture in a way that from many other areas in pop culture, in fashion, or cultural influencing in other areas. So that you be a bit bolder in using this material, rather than being on the kind of cautious side and say, well, does that image or does that short video potentially upset one of our northern taxpayers? It's probably not a bad idea if it does, but yeah, be a bit bold, be authentic, and hopefully it will work out.
And on the one hand, the humanitarian community do lots of coordination. On the other hand, they seem to fail at coordination. And there's this thing, I think, of organisations wanting to push their own, what they're doing, getting themselves on the banner. And I'll plug ourselves in BBC Media Action in our work. When it's community-facing materials, we don't brand it at all, because the community don't care where the information came from. And so I think, rather than coordinate, stop trying to control the message too. Like, I think it's really important to be very sincere in the community engagement and really wanting to make sure people can get the best information they can and listening to them as well. So thanks.
Wanjiku, I don't know if anyone else wants to add something, you can. Otherwise, there could be a very quick question.
Yes.
There's one general thing I would like to add to that. I think one thing we see from this discussion is that in the context we are talking about, we kind of need multi-directional communication. There's all the different stakeholders who should be involved. Obviously, the people affected need to be involved, but also the humanitarian actors. And I think that's one of the ways where media development organizations like BBC Media Action or Internews or DW Akademie can come in to kind of facilitate this multi-directional, multi-stakeholder communication, which is necessary. Humanitarian organizations are often very focused on communicating to basically towards home, to the publics, and to the donors, and to more Western countries, and they don't have necessarily much of a focus on the communication in the countries where they actually work. And I think media development can help to kind of leverage the information that is available on the side of humanitarian organizations and make it available to affected populations and get more feedback from affected populations, which I think everybody involved in communication in displacement settings needs to talk more. And this is also why we do this conference.
Wow, thank you so much, Aarni, for that roundup. I'm sorry, I have to cut you short because our time is running out, but I just want to emphasize that, like Tobias said, this discussion can go on for hours for sure, because we're talking about how to improve messaging and communication in refugee context, and we've gotten several examples of what could go wrong and also how to improve it. So thank you so much to our panelists for the Q&A session, for the presentation before, and thanks to you, our viewers, for participating. If you have further questions, remember you can still reach the experts directly through the app. So Eddie, what do we have lined up for tomorrow?
Yeah, tomorrow we still would have just 1 hour, and we would have to make do with one. But as you rightly said, people can always get back to the app and communicate with the experts. But tomorrow we'll be traveling to the world's largest refugee camp, Kutu Palong. That's in Bangladesh's Cox's Bazar. It's going to be packed because, of course, we'll be joined by 3 organizations. There's UNICEF, there's UPSHA, and Radio NAF, and the BBC Media Action. They will be discussing the topic peaceful coexistence and accountability in Cox's Bazar.
You definitely don't want to miss out on that. So join us tomorrow, same place, same time. My name is Wanjiku Mwaura.
And I am Eddie Micah Jr. Goodbye.
Goodbye.